This year in the U.S., nearly 55,000 women will be diagnosed with endometrial cancer, a cancer of the lining of the womb. It's the most common cancer of the female reproductive organ.
And Shelley Botat tells us why knowing what the symptoms are and telling your doctor about them can help save your life.
Endometrial cancer often produces symptoms at relatively early stages, so the disease is generally diagnosed early. The overall 5-year survival rate is over 91%. Bridget Maroney loves riding.
I just love being with the horse.
In June, Bridget noticed spotting outside her normal menstrual cycle.
It was just a little bit every now and then. Nothing substantial to make me worry at all.
At her yearly checkup, Bridget mentioned the spotting to her doctor, who sent her for a second opinion.
They had done an ultrasound, which had showed thickening of the lining of the endometrium, which is always a concern in a postmenopausal patient.
OBGYN Dr. Thomas Gallagher from Aurora BayCare Medical Center performed a D&C for further testing.
We dilate up the cervical canal and then use a scope called a hysteroscope. Pass it up into the endometrium and look around, and then we scrape that lining to get a sample for the pathologist.
The sample results surprised Bridget.
We found a low-grade cancer, or endometrial cancer.
So to hear those words about me, it just didn't seem true. It still doesn't.
Aurora BayCare has a team of cancer care specialists, so within a day, Bridget was meeting with gynecologic oncologist Dr. Peter Johnson. Bridget needed a hysterectomy to remove the cancer. They chose to do a robotic-assisted hysterectomy.
We could have done traditional surgery through a big up and down incision, but there's absolutely no reason to do that in terms of you get the same results with less pain, less scarring, quicker recovery.
In a matter of 12 days, I went from being a cancer patient to a cancer survivor.
Aurora's team approach can save lives.
Because we have all the specialists here, it enables us to get patients in quicker. And whenever anybody has a potential diagnosis of a cancer, or if they know they have a cancer, the clock is always ticking.
Every patient operated on for gynecologic cancer in the Aurora system gets reviewed by all the physicians who take care of women with gynecologic cancer. And it changes. You know, we talk about what we're going to do, and sometimes better ideas come up. So the team approach is superb.
Because the cancer was found early, Bridget did not require chemo or radiation. Doctors say she should be cancer-free and is now ready to get back in the saddle again.
I feel great.
The #1 symptom of endometrial cancer is bleeding after menopause. For premenopausal women, it is spotting between periods. If this happens, you need to talk to your doctor. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.
Thank you, Shelley. Well, forget about Spider-Man or Superman. Here's a real superhero. He's 12 years old, surviving cancer, and he's raising tens of thousands of dollars to help other kids just like him. That's tomorrow in Health Watch.
News now from your